I was invited to talk a little bit about One Health concept, and I thought, well, the best way is to bring here the experience of the University of Lisbon. And I'm going to talk about a PhD program that we called Planetary Health Studies. Our vision is to train the next generation of leaders to protect human health by protecting the planet. We create this program because in our time, human well-being depends directly on the stability of Earth's natural systems. Why this focus? Because human health and planetary systems are inseparable. Issues like climate change, biodiversity loss, food insecurity are no longer just environmental problems. They are major drivers of disease and global instability. When ecosystem fails, health systems follow, and this framework helps us understand and act on those connections. Current education systems are often not equipped for this complexity. Academic training is typically stuck in silos, medicine here, ecology there, often limited to short, isolated modules. So we identified a critical need for deep, long-term doctoral training that prepares researchers to work across these boundaries. Our response is a pioneering 4-year PhD program. It bridges health sciences, engineering, social sciences, and arts because planetary challenges do not respect disciplinary boundaries. This is a new model for the Anthropocene. One university, many disciplines, and one shared mission. The program is embedded in a vast network of 18, and now is 19, schools, faculties, institutes, research institutions, and external partners. We train students to be and to see the big picture, understand the social, political, and economic drivers of health rather than just isolated risk factors. We look at the curriculum structure, and the curriculum offers common foundations with flexible pathways. All students begin with core courses on planetary systems that govern and governance before choosing one of 6 specialization tracks. Over 4 years, they engage in research, internships, and collaborative projects designed to foster intellectual adaptability. We believe that knowledge alone is not enough. Values matter. We emphasize planetary health literacy, understanding who benefits and who bears the costs of environmental change. Our students tackle the ethics of the Anthropocene, including intergenerational responsibility and environmental injustice, to ensure solutions heal systems rather than repeat past mistakes. Our teaching methods are built for real-world complexity. We use active problem-solving approaches based on real cases like heat waves and urban stress. This trains our students to handle uncertainty, trade-offs, and conflicting evidence that decision makers face every day. We practice science with society, not just for it. Students co-create their research with policymakers, NGOs, and local communities. This ensures that their work is relevant and feasible, while training them to speak the language of policy as fluently as the language of academia. And this is more and more important. We move from complex systems to actionable decisions. Training includes advanced tools like systems modeling, data science, AI, as well as most traditional disciplines like epidemiology, infectious diseases, and so on. Students learn to translate scientific evidence into policy advice aligned with the global framework like the SDGs and WHO strategies. As a closing message, I would say that planetary health is not a niche. It is the future of health. Universities must evolve as quickly as the risk we face. This program is our modest contribution to forming the leaders who will protect both people and the planet. The question is no longer if we need this transformation, but how fast we can scale it. Thank you so much.